All right, we'll get started here in just a moment. I know folks are joining as we go live. Thank you so much for being here. My name is Kendra Bradner, and I direct our probation and parole reform project at the Justice Lab, which also convenes EXIT, Executives Transforming Probation and Parole. I'm going to turn it over to my colleague Clarice to just start us off.
Thanks, Kendra. Good morning and good afternoon, everyone. My name is Clarice Robinson. I'm the manager of EXIT, Executives Transforming Probation and Parole. EXIT is convened within the Justice Lab of Columbia University and consists of over 100 current and former probation and parole officers who seek to make probation and parole smaller, less punitive, more hopeful, and restorative. We're so glad that you could join us today. We will have a portion at the end for questions and answers, but for now, please use the Q&A function to put any questions that you have as the panelists speak. I'll turn it over to Kendra. Thank you again for joining.
Thanks, Clarice. And as folks continue to join, I'll just give a brief introduction to our topics today. So we're talking to representatives of two different jurisdictions, New York City and Multnomah County, Oregon, who have made expanded existing programs and also made changes to respond to the COVID-19 pandemic in primarily two areas that are really important to supporting people as they return from incarceration or other legal system involvement. So we'll be talking about food access and also healthcare access. And I'm really excited to have our panelists here today and excited to discuss with all of you. I'm going to have each of our panelists introduce themselves, just briefly share their name, title, a few words about your organization and the background that brings you to this conversation. So I'll start with all Multnomah folks and start with Ederlinda.
Hello all, my name's Ederlinda. My nickname is Ed, she, her pronouns, and I'm happy to join you from Multnomah County. I'm with Corrections Health, which is in part of the Multnomah County Health Department. My role here is new as of the last 3 months. I'm the COVID Quality and Compliance Coordinator, and previous to that, I was the health specialist embedded with the DCJ HAT team, the Health Assessment and Treatment team.
Thanks so much, Ed. And I'll go to Leave. Oh, just make sure to take yourself off mute.
There you go. Good morning. Leave Jensen in Portland, Oregon, which is part of Multnomah County, Oregon. I am the manager of transition services in Multnomah County, Oregon, Department of Community Justice. And I'm excited to be here today, and I appreciate everyone's interest.
Thanks so much, Lee. And Stephen, I'll go to you next. Oh, just take yourself off mute.
There you go. Hi, everyone. Good morning. Good afternoon. My name is Stephen Case. I am the director for what we call CRU, which is Community Resource Unit here in New York City, Department of Probation. I'm one of those strange people. I've been at probation my whole career, about 30 years. I actually started off as a probation officer trainee. So I know the department inside and out. And I have climbed up the ladder. As you know, probation is a sentence in lieu of incarceration. So 99% of our clients have not been incarcerated. They took a plea. We have over 20,000 people here in New York City that are currently on probation that we provide services to. And I'm excited about being here and sharing our experiences. Hopefully we can have a takeaway from this for you, because what we do here is a little different from everywhere else, I believe.
Thanks so much, Stephen. And we have one additional panelist, Jordan Stockdale, who'll be joining us just shortly, but let's dive into the conversation. Stephen, I'm going to start with you. I'd like, you mentioned that New York City does things a little bit differently. Many folks on the webinar may have heard of the NEON model more broadly, but I wonder if you can talk a little bit about the Neon Nutrition Kitchen specifically, sort of how that project started, who's eligible, and how the program expanded during the pandemic.
Sure. Like I said, I've been here a long time, know many officers and many programs. Part of my job here at Probation and my unit is to find programs throughout the city of New York, whether it be drug treatment, mental health. So back in 2015, our deputy commissioner was alerted to the fact that our probation officers were giving our clients their lunch. Our clients were hungry. And I don't know about anyone here, but when you're hungry, you really can't concentrate, and your main cost is food. It's a basic human need. So he charged me with going out and say, how do we fix this? So the easiest thing and the easiest way to do this, I said, is a food pantry. Not that I knew anything at all about food pantries. So he gave me a long leash, if you may. And I went around the city, and I probably looked at about 15, 20 different food pantries on how they operate. And this was something new to probation because, of course, we never did food before. We may refer people out when they need help, but we never had food. What I discovered was when I came back was that it was very disheartening how people who need food are treated. And let me see your birth certificate. Where do you live? Do you live in this zip code? And the one thing I said to our deputy, Michael Forte, was, we don't want to do it this way. If people come and then request food, especially our clients, it started off with our clients, especially with our clients, we want to be respectful. We want to not push them further down the ladder. We want to raise them up. And that's always our goal, is to raise up our clients. So this was another way to reach them and their family as they try to make the transition to a legal life and jobs and everything else that happens. So in 2015, we opened in the Bronx with the help of Food Bank for New York City. Food Bank for New York City and Jordan's Young Men's Initiative, when Jordan joined us, is a wonderful initiative. But they helped us set up our food pantry. We actually started the food pantry in a little small area, I want to say 20 by 20. And it was amazing of the outreach that happened. The community found out about it through our clients, because we supervise our clients. Part of the Neon model is to supervise clients within the community. So through word of mouth, it just got expansive. And the first month in the Bronx, we served over 5,000 people back in 2015. We thought that was amazing. But as amazing goes, we then started this in other boroughs, really realizing that there was a need in the Bronx. So if there was a need in the Bronx, there was a need in Queens, there was a need in Manhattan, Brooklyn, and Staten Island as well. So we opened a food pantry back in 2015 in each of those boroughs. And by the end of the year, we were up and running. So it took us 6 months to open 5 food pantries, which is pretty amazing because we had the space and we had the dedicated staff at probation that actually believed in the mission and saw the difference in the clients as they received food. So the clients were able to receive food when they came in to see their officers, no questions asked. They'd walk over to the pantry and we'd serve them and give them food that they could take home. Come Thanksgiving that year, we were able to secure somewhere around 200 turkeys, and we gave it to them that way. And we saw that the recidivism rate of these clients actually came down. They were open more with their officers. They were open to other programming and things that could assist them and help them because they felt we cared. By giving them food, it was a whole different dynamic, and it worked. So fast forwarding now to current day, back then we did 1 day a week for the community. So we would serve the community from 9 to noon at those locations. And it was amazing how many people showed up. As I said, it wasn't just our clients. The clients could come and they see their officers, but those 3 hours we had lines lined up for food. And what that did as well is brought probation. People really don't know what probation is. They confuse us with parole all the time. Oh, these bad people. We have to explain to them that these people live next to you and, ride the bus. And it opened up. And the Neon Experience does that for the community. And we invite them in. We have poetry readings. We have all types of different things for the community to come in, whether you're on probation or not. This was just added to that. And it actually assisted us with breaking that barrier in the communities that we serve within New York City. So if I may fast forward to COVID, we expanded. And what I mean by expanded, we blew it up. We now serve the community 3 days a week at each of our locations. I receive anywhere between 15 to 20 deliveries a week at the numerous locations. And in 2020, since I do the stats as well, during COVID, we served over 390,000 people here in New York. We fed that many people. So the need here was great, especially with people losing their job. So that just wasn't our clients. That was the community at large. And as of actually yesterday, I did the stats for last week. So the first week in April, when spring has sprung, if you may, we served 12,000 people in 1 week. So the need is great. The community are respectful. The clients are actually excelling by having food, because when you have food in your belly, then you can concentrate on the other things you need to do. So that's our goal. That's what we've been doing right now. And I'm proud of our department. I believe we're the only department that actually serves food to the community as well as our clients and able to take it home. So it's a wonderful experience. We have full-time staff that man the pantries, plus the community may come and volunteer. And the clients actually, our clients on probation actually come and want to do good. They want to serve the food. Like, hey, you help me, let me help someone else. So the model has enriched their lives as well. So for me, this is one of the most rewarding things I've ever done working for the department.
That's incredible, Stephen. Thanks so much for sharing that background and some of those outcomes. It's humbling to see how much need you're filling, but also to recognize that means such a need is there. I want to pick up on something that you mentioned. Most people, when they think about probation, don't necessarily think about it as a place to get food, as you suggested. But I wonder if you could talk a little bit about how your team, or expand upon, you already started talking about this a little bit, expand upon how and why your team saw this as part of the mission, and how it might segue into other things that you're doing with the community or with your clients.
That's easy. Everything just flows from assisting people with food. There's no shame involved. There's no looking down at someone because they have their hand out. So what happens is when we give the food, let me go back a minute, even the younger clients, that was a challenge for us, because, we have clients as young as 16, right? That may be living with their grandmother or their mother, and may have a few brothers and sisters, and they would come with their backpacks on, and they were like, I ain't carrying that bag home. I ain't doing, blah, blah. And we would stop, and this is our staff would stop and say, wait, wouldn't it be nice for your brother to have a hot meal tonight? Or wouldn't it be nice for mom to be able to make this chicken for you when you open the cabinet to see it? And the fam, when we convince them of that, and they put the food in the knapsack that they got on their back with one book in it, and they put the chicken in there or whatever it may be, the next time they come back, they ask for it, because the feeling of them bringing something in the house and their family being able to partake is a win. And that builds our relationship, because inside of them, I feel they felt they did good. They were able to contribute where they couldn't before. So our staff is constantly speaking to them, letting them know this is the first step of your working towards your goal of a job or whatever the case may be. We have at probation through the Neon, we have an employment unit. We have a mental health unit. We have everything in place, but I believe everything starts with the food, because it is very difficult and things have become more expensive, and their EBT cards don't go as far as they used to any longer. What I've currently done with staff is we've been focusing on, believe it or not, fresh fruits and produce, which is very big there, to serve, because it's something that's missing in a lot of their diets. We actually asked the clients about that, and they said, "Oh, we would like this too, besides the meat." They know I'm always going to have meat. The meat's going to be there, but they were asking for other things. And when they ask, to your point, is, again, when they're sitting with their officers and they're going over their case management plan on their goals and achievements and what they must do, they can do that now with a clearer head. And the officer walking them over and providing them food actually builds a trust level that was not there before. And that is how we were able to change the lives of so many. And currently, like I said, now they're volunteering, which is fabulous to see. You know, we go through the COVID protocols of wearing the mask and doing everything, but you can actually see the change in the individuals and a positive change. The rearrests are down. People are helping one another. I watch sometimes. I just go and watch. I give out food as well, but I like to watch when the clients interact with the community, or a senior that may be on our line. And let me put this in there. And it's a good feeling. You could see the client themselves, who've never done this before, are now having a sense of self and a sense of pride by helping others, which just funnels out in other areas that they need to be doing. So I hope that answered your question.
Yeah, it did. Thanks so much, Stephen. That was really, really fantastic. I'm going to stay on New York for now and turn to Jordan. Jordan, before I dive in with a question, that I want to give you a chance to just introduce yourself, name, title, your organization, and a little bit about your background.
Yeah. Hi, everyone. My name is Jordan Stockdale. I'm the Executive Director of the Young Men's Initiative. We are an office of the mayor that's explicitly focused on reducing racial disparities and empowering our young people. And we do that through investing in and co-managing programs across criminal justice reform, workforce development, health, and education, which includes mentoring. So I'm really excited to be here, and apologies for being a little bit late, but very excited to be here with my co-panelists.
Thanks so much, Jordan. So I have a similar question to start off with you. You know, when New Yorkers think of the Young Men's Initiative, they might not immediately think about food. Can you talk just a little bit about how food access fits into that broader work of the Young Men's Initiative that you described?
Yeah, and Stephen touched on this before. You know, when you're hungry, you can't focus on other things. I'm a former teacher, and so I saw, you can see that in your students. When your kids need to eat, they're not thinking about learning in class, right? It's Maslow's hierarchy. You've got to meet the basics before you can elevate folks and before folks can reach their full potential. And so, when the pandemic happened, unemployment skyrocketed in New York. And a lot of people are in the service industry and face-to-face jobs. And basically all face-to-face jobs paused or stopped or ended. And so you had a huge number of people who are unemployed. And thus you had, an economic crisis that had lots of implications, including access to food and access to healthy food. And so when the opportunity was brought to us to help this initiative to provide food through the neons, which are already baked into the communities, which are already seen as as legitimately part of the community and something that's helping on many different fronts, we jumped at it and we were really excited to participate. I just want to highlight a few of the things that Stephen said that were really cool. We actually have young people at the neons distributing the food, right? And when you do that, the young people, feel the love from the community, as the grandmas come up and say, "Thank you, young man, for giving us this food." They feel that love. and they develop an investment and a bond with the community that everyone does when you give back in a meaningful way. And so that service work actually improves community cohesion. And when you feel that love of the community, you are less likely to want to break that bond or to harm the community that you see loves you as well. And particularly for the young males of color out there, it may be difficult to always see that love in the community depending on where you are. And so that service work is a huge part of gaining that mutual trust and mutual love. So again, we jumped at the opportunity. We're really happy to participate in this initiative and happy that it's feeding so many people and it's providing resources at a time when they're really, really needed in New York City.
That's great. Thanks so much, Jordan. I know Clarice put a reminder in the chat, and I see a couple people have entered questions in the Q&A. Just want to remind, we've gained a few more attendees in the last few minutes. Just want to remind everyone that we will save some time for questions at the end. Rather than putting them in the chat, on the right-hand side of the bottom of your screen, you'll see the Q&A feature, and feel free to drop your questions in there at any point during the conversation. And like I said, we'll return to them at the end. Jordan, I want to stay with you for a minute. I know YMI has a number of different partnerships with the Department of Probation. I think the NEON model, as you said, is really cool. It's embedded within the community. Their services are open to community members, not just people who are on supervision. I can imagine that that's a ripe jumping off point for a whole bunch of different types of partnerships, but I wonder if you can walk through just what some of those are.
Yeah, we have a ton of different partnerships with the Neons, and so happy to talk about that. But first, I just want to say my first time in the Neons was in the South Bronx, and they were having an open mic night poetry event. And I was like, what is this? This is incredible. I mean, people really came out. I ended up reading a poem that I had in my back pocket. I didn't even know it was going to happen, but I was like, oh, I just felt inspired. So I had to go in there and read a poem as well. And it was beautiful. You could tell people really felt comfortable, and they felt that this was a loving environment where they didn't come to be judged, but came to be empowered. And so just a little bit about some of the initiatives we have. One is Knockout COVID, which is the Knockout COVID Youth Campaign, where we partnered to pay young people to develop campaigns around the importance of social distancing and adhering to the health guidelines. And so we launched this last May, kind of near the height of the pandemic. And young people developed videos, memes, posters that was authentic peer-to-peer communication about the importance of social distancing. They have a slogan, "Don't ask, stay masked." And we've actually put these videos, we pushed them on social media, and we put some of the memes and posters on the New York City links. And so folks that aren't, in New York City, we have, I guess I don't totally know how to describe it, like a TV on the corner of a lot of the blocks that showed, different information. And so we put those memes and those social media assets on the links. And I know the young people felt proud of that. They saw that and they said, this is my work right here. And then, it's better to come from young people that actually can relate to them and can encourage them to practice social distancing, as opposed to, paying some PR firm or a bunch of adults to do it. It's like, folks know what works for them. And so that's one of our initiatives. The other was Neon Summer, which, so let's take a step back here. Last summer, there was about a month-long period, or maybe 2 months, where the Summer Youth Employment Program was canceled because of COVID. And that generally employed about 75,000 young people during the summer. And so when we heard that, we worked together. And I just, got to give all the credit here to DOP, just the incredible teams that really get on it when they see there's a gap of services and where they can fulfill that gap. But we created a program called Neon Summer, which provided paid learning opportunities to 2,700 young people between the ages of 14 and 24 who were either on probation or connected to the Neons. And the learning opportunities included, exploring different careers, different career opportunities, social emotional learning curriculum, dealing with disappointment, knowledge of self, history, things that promote confidence. And the idea was to provide structured paid learning opportunities for young people during the summer, that given that we thought SYEP was going to be canceled, which it thankfully ended up actually not being canceled, but we had that opportunity, the Neon Summer, that did provide inclusive learning environment for a lot of young people this summer. There's actually a magazine of all the work that the young people did that's on the DOP website that you can check out if you're interested in seeing, the kind of learning projects that they engaged in, the young people engaged in. The next is the Community Crisis Response Initiative. We love this initiative, but basically we allocated $500,000 to community-based organizations that provided mentoring, tutoring, or social emotional support to young people during this last school year, which was really difficult because young people had to learn online for the first time. And I don't know about you all, but I could barely focus in high school when I was in class. So I can't imagine how folks did that online. So that was a partnership with DOP that was really powerful. And we were able to help 25 different CBOs that engage in that work with the young people connected to probation and also in neighborhoods surrounding the Neons. The next, there's also Neon Works, which is another partnership of ours, which is a workforce development program for people on probation or connected to the Neons. And that's going to service 1,200 people this year. This is the first year of the program. And so that's also another powerful program that Stephen spoke about earlier. And lastly, historically, YMI has been really connected to the mentoring programs at DOP, including ARCHES, which is a credible messenger mentoring program. And it's really guided our philosophy on our mentoring programs across the YMI's portfolio, and which is we believe that if we hire people with lived experience that are able to bond with young people in a different capacity, or in a capacity meaning that they share similar life experiences, that will actually help the young people grow in a different way than it can be done if the mentor doesn't share their experiences. And so that's ARCHES. I think it's a national model now of hiring credible messengers. It provides a job for people in the neighborhood, a very important job, and it helps the young people. And so in all of our mentoring programs, we have an aspect of ensuring that the mentors understand and or lived the experiences of the young people they're actually mentoring. So.
That's great. Thank you so much, Jordan. So a lot of stuff mentioned just there. If folks are not familiar with the Neon model, with ARCHES, with the credible messenger structure, I highly encourage folks to look into it. I wonder if Jordan or Stephen, if you have links to descriptions about the Neons, the ARCHES, or that magazine that you mentioned, Jordan, which I've seen and is amazing, that contains the artwork and a lot of the contributions of the young folks. I think those would be great to share in the chat if we can do that by the end. A lot to build off there, and especially the idea of investing in folks, investing in their potential, making sure that we're covering basic needs. And also using food and connections to the Neons as a jumping off point to figure out what else might really help people thrive. I love those ideas. Ederlinda and Leave, I'm going to turn to Multnomah now and talk a little bit about health access. I think there's a lot resonating in what I've heard you share previously that I'm eager to build off of here. Ederlinda, I'll start with you. So you are not employed by the Department of Community Justice, which is Multnomah's Probation and Parole Department, but I know you work very closely with them. So I wonder if you can talk a little bit about what your role is and how that partnership works.
Yeah, happy to talk about it. Really proud of the HAT team, and that stands for the Health Assessment and Treatment Team. And I began with a grant that Leave thought about, and a couple of other collaborative folks from Corrections Health, and was really to how can we bring that lens of public health into probation and parole, and how can we become partners in all of the conditions of supervision, and then also growing a healthy and thriving community, and having people rejoin the community and have some say about about how their life is going to go. And so the HAT team was born, and it was community health specialists, members of Leaves team, which is the transitional services unit. So we had corrections counselors, probation officers, and really the idea is to look at ways that the two disciplines could intersect and really meet the client's needs and have them become engaged in their process of reentry into the community. So many times, especially for folks who are long-term incarcerated, that became their health system. And then they're released into the community. And where's the continuity of care to really look at prescriptions, looking at engagement and treatment, figuring out how to get a primary care provider, really navigating a very complex medical system. Even with the best of information, I find myself getting lost. And when I'm lost, it's nice to have a map, or it's nice to have someone who can help you navigate that kind of like, cluster of twists and turns and roadblocks. And we're talking about a population of folks who've actually been really hurt by the system in many ways. And this is kind of one of those ways that we can offer a helping hand and make sure that people can really address the needs that they have that are a priority for them. So in public health, we really focus on social determinants of health, and we use that as a driving force in figuring out the needs that clients want. And it's a great place to figure out, where can a probation officer and a community health worker and the client really come to this common place where they can work forward. And it's really interesting because it wasn't just changing for the clients, but also changing with our POs. And now it's hard to imagine having probation, parole, and supervision without the HAT team, because so often I would get phone calls saying, this person really needs their meds, or this person's really having a hard time engaging. You're hearing the language of trauma-informed care. You're hearing POs become invested in things that haven't been historically part of that dialogue. So I think it was brilliant. I think that we can never have a program like that without having all of these partners involved. I think it requires all of these disciplines and all of their lenses to really focus on how we can, support our clients as they reenter community. And health is a big piece. If you don't have food, if you don't have your prescriptions, if you don't have all of these basic needs, how can we even begin to start looking at the conditions of your supervision? I mean, it's just seems like a no-brainer, but it's so essential. And I'm just so happy to share this information in this platform.
Thanks so much, Ederlinda. You started talking about this, and I wonder if we can build on it a little bit. You talked a bit about the importance of health access for people coming home, and how that continuity of care is really a challenge. Can you talk a little bit more about what barriers to healthcare access that folks might be experiencing? Maybe a couple of examples to help people understand what that lack of continuity of care might look like in the real world.
I'll talk to you something really simple. When someone goes in and they're booked and they're maybe on the Oregon Health Plan, they lose their Oregon Health Plan, and then they come back out. They need someone to flip that mechanism. And we have a team now of folks who are focused in corrections health and the transitional services unit who are empowered to flip that switch to get healthcare back on. So something as benign as that, as making a phone call, switching coverage, making sure your care plan actually can meet the needs for your treatment or for your medication that you need. It really requires someone who's in that system. And being part of corrections health allows me with ROIs to review their care plan, see what meds they were on before, advocate for getting those medications, setting up folks with primary care providers who might have a better ability to work with folks who haven't historically accessed the primary care model. Most times, our clients are considered frequent users. They use the emergency room and jail as a way to get their needs met. Really, the HAT team has helped to figure out a new set of skills. I always come from a strength-based approach. That worked for you at one time for you to access and get your services. Now we're going to learn a new set of skills where you're going to actually call, make an appointment, meet your primary care provider, interview that person to see if they really can meet your needs and navigate that system. Usually it's like, the population that we work with is just very used to being told what's next, where do you go, what to do next. It's really this new thought of like, how can we empower folks to really advocate to, one, identify what their needs are, identify which direction they want to go, and then start figuring out how to go in that direction.
Yeah, I think that's crucial. Again, sort of investing in folks' agency and self-determination. Those are really big ideas. Thank you. Leave, I want to bring you in and talk a little bit about from your side. So you do work for the Department of Community Justice. And I'll ask you a question similar to what I asked Stephen at the top. How does health access fit into the mission of your probation and parole agency?
I think it's critical and primary to us. We know that it's important for a person to be successful, to integrate successfully, and our goal is for people to leave our system and to have all the tools and things they need necessary. What we usually tell our clients, we hope we never see you again. Don't take it personal, but we do want you to be successful and get all the care and services that you need to be successful. So it's really important. And I would say that from the beginning of the start of transition services, we've always had that focus that we wanted to make sure that we were looking at the continuum of care from incarceration to the community, that we're really looking to make sure that they have the continuum of care that will make them, help them be successful. And when we expanded to include the HAT team, it was because we knew that it was critical for folks who had chronic health issues that we had specific supports in place to ensure that they were able to keep and maintain their primary care appointments and those sort of services. I'd like to take an opportunity, if it's okay, to go through some mechanics of transition services. I have some slides to show you how we actually prepare for someone leaving the institution, as well as some of the other tools we utilize to make this possible to work not only with Corrections Health, but with our community partners to make sure that when we're looking at a case plan, it truly is care coordination, that we are working together in the best interest of our client that we're serving to work together for them to help them make better choices and to also integrate successfully and to pick and choose the things that they would like to do to also help them on their path to success. So Clarice was kind enough to walk me through how to make this happen. So let's hope that I am as successful as our training. So bear with me. There are people on this call right now. We're going, oh my God, Lee's going to do something technical. Everyone hang on. The other thing I'm going to share with you when I'm putting on these slides, I am about, oh, did I make it?
We don't see it yet.
Do you see it now? Oh, wait a minute.
So you're clicking share.
I'm in the wrong place. Okay, here we go. Can you see it now?
Yes.
And can you see it in the mode that you're supposed to? Yes? Hello?
It hasn't enlarged yet, Leaf.
Okay, I'm clicking on.
There we go. Perfect. Yes.
Excellent. Thank you. So I just wanted to share really quickly, we are Multnomah County, Oregon, Department of Community Justice. And within community justice, we have the director's office, the adult services, which is probation, parole to the rest of the country, but we refer to it as post-prison supervision, and pretrial, as well as juvenile services. So within our department, we have many entities within this, within our organization. I'm going to focus on the adult services side, specifically working with folks for probation, post-prison, and pretrial, whether they're releasing from prison, jail, or if they are at risk of being homeless, or if they've experienced homelessness, and how we engage them. Okay, now let's see. I am hoping that I can do, I am on the next one, next share. How do I, sorry, everyone.
That's okay. Clarice, do you want to share and see if you can advance from your end?
Sure, give me one moment.
Sorry, everyone. I am clicking everywhere, but I've clicked on everything on my screen and nothing moves.
That's okay. We have Dylan in the chat telling us that this is a frequent issue. It's not just us.
Oh, okay. That's good to know. Well, the next thing I was going to focus on, I'll talk a little bit while I'm talking about it. Here we are. So the second slide largely just highlights what we do at Transition Services, and it's connecting folks, making a plan for when they're getting out into the community, making sure they have access to safe and suitable housing, making sure they have a plan for their medical and mental health and, you know, assessment and services, making sure they have medication, making sure they have OHP. And most importantly, we're trying to coordinate a care plan for that individual. The next slide is going to basically show you our continuum of how we set that up for people who are releasing. One of the reasons I wanted to share with you, it could start 6 months or even longer before someone gets released, that we start making these connections. We are reaching into the institution, setting up a conversation with the person who's releasing to check in with them, what their needs are, what their concerns are, as well as working with the corrections health within the institution, as well as the release counselor, making sure that we understand all the things that this person will need when they release to be successful: housing, support, healthcare, anything else that may be important to them. Additionally, we're trying to make sure if they have to apply for Social Security, will they be OHP or will they be Medicare? How will we make sure that they have medication after their first 30 days? Who else will they need to follow up with? Are there other people in their life that they want to make sure they're connected to, family members, friends that they've been working with while they've been incarcerated, that we want to make sure that they are also in that care coordination and getting that support? In Transition Services, we have specific corrections counselors who are identified to work with certain populations. So when they get that case assigned to them, they actually are starting that process. They're doing the reach in, they're identifying their mobility needs. Will they need an elevator? Will they need care because they need assistance with bathing or toileting? Will they have an issue with being assessed for mental health, to have an updated assessment? Things along those lines. And also with medication. We have someone who specifically works with behavioral health. She makes sure that they have their medication when they get released, that they have a follow-up appointment, that we're making sure that they're able to have that true continuum and have everything in place for support. One of the things I just want to share as an aside, we talked earlier about how important food is. Prior to COVID, we offered breakfast every morning at our probation and parole office. So folks who are living in our supported housing could actually come to breakfast every morning and check in with a counselor to let them know how they're going. So food is critical. And people sometimes find it interesting that people would actually come to a probation and parole office for breakfast, but we always had a great number of folks who were coming to have to be connected to. It also provides an opportunity for their probation and parole officer to also meet with them to make sure that they are connecting or they're getting their questions answered, that sort of thing. It really has that feel of a connection. The other thing that it does when we look at this plan, it makes it possible for us to determine making sure that we have our health and assessment team as early as possible notified of the plan. This is something we know that they're going to need. And what's been really critical, and I'm just going to give a shout out to Ed, because Ed talks about how it started, but Ed really is the one who made this program bloom. There is no doubt about it. And one of the things that we've been able to do with Ed's help is understand how early we need to get HAT involved, and she's able to ask those questions. The other thing that happens for the community health specialists, they also reach out to health services in the prison and get records that should only go to the folks, quite frankly, who are in the health capacity. They were able to get those records and make sure that the clinics in the county had access to that information, so they truly could plan for a continuum of care in regard to their health needs. So this partnership has been actually successful on many levels. But when you will also see that we're also identifying their mobility and other health issues, will they have to do voc rehab? Will it be possible for them to be employed? Those things are pretty critical when you're making a plan, because that way you can work with community partners and make the appropriate referrals at release, as well as it helps the supervising officer know what are some of the things that they should be working on in their case plan. The other thing I just wanted to say in regards to coordinating and having that plan, it makes it possible to have conversations with the place where they're going to live with their housing provider. And I'm going to go to the next slide to show you how that works. Now I'm about to show you something that's pretty fabulous. So a lot of folks on this call, they're probably going to go, I want this, and everybody's going to want it. We have our system in the state of Oregon, and it updates our information on a regular basis about who's releasing from our institutions. We get that information updated daily, and it feeds into a program that we call Tiramisu that makes it possible for us to plan for people's releases, as well as prepare this referral form that you see that we actually prepare for our housing providers. And in that referral form that we're sending electronically to our providers, we're able to talk to them about what we're seeing, the needs and concerns, and the things that we're going to be working on together as a care coordination plan while they're living in housing, and we're working together for that integration successfully. It will also feed into a case review. The housing provider will take that information and will put it into a case review that we're all able to see electronically. And when I say all of us, I mean our HAT team, probation and parole, our housing providers, and transition services counselors are all able to see this case plan review electronically. So we're able to keep track together how the case coordination is working. When there are issues, when there are concerns, when there are things that are being lifted up that we should be following up on with the individual. We know maybe the individual is struggling with something, whatever it may be. It can come up in the prior to the 30-day update or at the 30-day update. And then we know as a continuum of care coordination that we should be meeting together to figuring out how we're going to assist this client. Or should we be making a different referral? Or should we be working on a different housing plan? What's really awesome about this is because we set this up, this foundation that we had prior, nobody knew a pandemic was coming, but when it did, we are working virtually. Yet we are still able with this system to prepare this referral form, send it to our housing providers, and continue this case review, which supervising officers also have access to. And corrections health through our HAT team also has access to review. So we are able to maintain the same level of service with case coordination virtually. We're all over the county, but we're able to maintain and work with our housing providers and our officers and nurses and community health specialists because we're all utilizing the same information. We have it electronically, and we can update it electronically and make the changes that we need to make so that we're always able to make sure that the client is updated with their care plan and that it's consistent, that we're able to assist them.
That's great. Thanks, Lee. I hear a lot of things in what you're saying in terms of this theme of making sure that we're meeting basic needs and making sure that folks have support in navigating systems, which can be extremely difficult and confusing in the best of times for the most well-resourced of folks. And we know that folks who are experiencing supervision or who have experienced incarceration often are not walking into those situations with ample resources. So I love those ideas. Leave and Ederlinda, I want to pose that sort of a joint question to the two of you to talk a little bit about, or to expand on what Leave just started talking about, which is how these things shifted during COVID, whether that's the needs of clients that you were seeing shift or how the response shifted during COVID.
Well, you know, when COVID hit, there was a few other things that became like a priority. In Oregon, our highest, our sites with the largest COVID outbreaks happened to be our prison system. And we needed to shift gears and start thinking about what transition looked like when someone was transitioning from what we call an endemic facility, an institution that had widespread COVID outbreak, and how we could help them transition into the community safely and actually be able to quarantine safely with enough services and then move to their next housing site. I safeguard the transitional services unit housing deeply because housing is the key, and it's also where we have a lot of lack of resource. We need to like really build up housing. Housing first is going to always be my mantra. Housing first, and then let's figure everything else out. So we shifted. We started looking at quarantine. We worked really closely with communicable disease, figuring out how someone could transport from prison into Multnomah County safely, meeting CDC guidelines and public health guidelines and Oregon Health Authority guidelines, transition to we call them VMOs, the voluntary isolation motel, receive services that folks want to get, especially when they first release from the community, from either jail or prison, and then move after quarantine is clear safely into our transitional services housing. And so we did have a lot of shifting and a lot of transporting of goods from where were our normal home base to these VMOs, bringing clothing, supplies, food, coordinating with all of these entities, but and making sure that folks had access to testing, COVID testing as well while they were there, and also treatment. So these were all good things, but I'll let Leaf take another.
Yeah, Leave anything to add in there?
The only thing I want to add is I shared with you earlier about our referral and case plan. One of the things that foundation also did, it made it possible for us to guide who needed to go to isolation motel first and then next to their housing. We were able to track efficiently with our local public health authority and to make sure that we were placing appropriately who needed to isolate and then who could move on to congregate care. And we were able to track that within our system and making sure that we were not placing anybody in harm's way when they were releasing from an endemic institution. So that foundation, again, that we set up much earlier actually helped us immensely to keep our conversation going, as well as to make sure that we had something that could guide us so that we knew who was where, because there were additional steps, and also provided information that we needed to. And as things change from endemic to non-endemic, we were also able to update daily, if not hourly, that information. The other thing I would say is our communication and our understanding of being in touch with each other on a regular, consistent basis was also critical during this process, because we had to update each other regularly, and still do, as we still continue to move people into isolation motels. But now we're using it to help us with vaccinations. So now if they get their first dose while they're incarcerated, we're able to track and make sure they get their second dose, and making sure that we're connecting them to that so they can get their full vaccination if they're not able to get both doses while they're incarcerated. The other thing that it does is that, well, Ed could speak too much better than me, is making sure that people are getting vaccinated in our local jails, and that if for any reason they can't get their second dose in local jail, working with the community health specialists of the HAT team to ensure they get their second dose. So it's been really powerful for us, because we've been able to take all the things that we developed for this piece to make sure, again, continuum of care, getting their vaccination and getting their needs met.
That's great, Leave. I'm going to be sure that we save enough time for question and answer. I see questions coming in the Q&A. Just a reminder to drop questions there at any point, and we'll return to them at the end. Before we turn it over to Clarice to moderate that, though, I want to toss a question to the group of all of you. So Stephen, Leave, Jordan, Ederlinda, any of you can jump in here. To zoom out and think about what lessons should our audience take forward. What are the changes that we've seen or experienced tell us about what's necessary or possible with respect to food support, health access, or any of these other areas of support, connection, barriers that we've seen for people who experience supervision. And I'll let whoever wants to jump in first do so.
I guess I'll go first. It's it's just easier. I think what's important, what I've learned from this over the time and working with Jordan and the great people here in New York City is that you have to think outside the box. What's in front of you is not always what's needed. There's things behind the person, behind the shield. With food, for us and the food insecurities, there's a wealth and I do mean a wealth of people wanting to donate, and not just people, but programs and things of that, whether it's money to purchase food, whether it's food itself, to think outside the box where you can, the littlest thing changes a person's outlook. Jordan mentioned that before with grandma and the Arches kids, which is a wonderful program, helping us at the pantry and the change in these individuals. And we have a problem, of course, with the drooping drawers when with our clients, with the young kids. We have pull it up when they're working at the pantry, and it's a whole self-esteem thing. So although it's food, it's not just food. It's self-esteem. It's building the individual. It's helping the community. It's just, you can't be in that box anymore. The box doesn't work. We have to look outside the box. So that's how I feel, how this has helped everyone.
Thanks, Stephen. Others on that point?
For me, the thing that COVID has done is really amplified what we have, who are involved in this work, know is that the criminal justice system is overly represented by certain populations. And when I go to each of these modules and dorms and talk about vaccine, and knowing that a majority of these folks are going to exit and re-engage with the community, it's really about protecting the community and changing the language. Instead of talking about folks as whether they've been incarcerated or justice involved, but really talking about our community members and their level of risk. I guess this is, not sure like if I really want to say this, but there's really no good way to truly protect people from COVID in a jail prison setting. There's just really, it's very difficult. So if we can look at justice reform and release people who need to be released and not keep people incarcerated, that's kind of where I'm looking at shifting the lens and looking at who do we have disproportionately represented there, and who are pre-adjudicated, and who should not be sitting in a dorm waiting to get tested, waiting to be released while they could potentially be exposed to COVID. Seems to be like an excellent dialogue to engage in.
Leave or Jordan, anything else to throw in there?
Just that I wanted to agree with Stephen and saying, thinking outside the box and being open and willing to do something different is always worth it.
Go for it, Jordan. Any final thoughts before we toss it to the Q&A?
No final thoughts. I mean, just echoing the importance of ensuring that only the people that need supervision should be on supervision is really important, and particularly in jails, and especially right now, given COVID. Yeah.
Thanks. Great. Well, with that, I'm going to turn it over to Clarice to take us through some questions from the audience.
Sure. So our first question says, these are amazing programs. Young women of color who are incarcerated or on parole or probation don't often have access to as many programs as men. Are these programs open to women as well, or is there a young women's initiative?
Yep. So our name, I think folks constantly think that we're only serving men, which is understandable because it's in the title. But we actually serve all genders, and our programs serve all genders. So don't let the name fool you, although I understand why the name fooled you.
What barriers did you face getting community and CBOs to collaborate and partner with the probation department, and how did you overcome those barriers?
I think of really building relationships. When I think about the ease I have of picking up the phone and calling one of our community partners, that has been time invested over the years of building those relationships, breaking bread with others, really finding these parts of the narrative where we intersect, where we've all struggled and all have had to make different choices. And it seems to be, I love telling stories, and I love talking to people, but that seems to be the biggest way that I've built relationships over the years with the different community partners and CBOs. I usually have a really big lechon at my house. I can't wait till I can have a big pig roast at my house. I have a lot of people to invite this year or next year, depending on COVID.
Would any of our New York City folks like to answer that question as well?
Well, besides food is what I've been speaking of now. My unit's also in charge of 800 programs, believe it or not, throughout New York City. So the CBOs and the relationships, and as I stated in the beginning, I've been on the job 30 years. So I've built these relationships through the years. And although the person may change program to program, the relationships stay the same. So it's not difficult. It's being open to change, and the programs themselves being open to the need of our clients. You know, we shifted to change, as Ed said before in one of her statements. Ed said, you know, it's not calling them probationers. We're all in this together. They're clients. They're within the community. We have to all be one to make this work. And the CBOs here in the city, I'm sure Jordan would echo this, are on board with us for services on whatever we may need.
Okay, our next question says, have there been other needs expressed as a result of your data collection and interaction with participants in the community? If yes, what additional development ideas of the NEON model have been discussed?
I guess that's me again. So so what happened, there was a need. We started clothing closets. I think Liv just mentioned some clothes. So we have clothing closets at each of our NEONs. So we bring out clothes. We actually started this for interviewing for our clients, but it has just exploded with clothes as well, of people giving donations. So now we have a staff, or actually a volunteer member, we consider staff because she's there just as much as staff, that actually sets up all the clothing to go out, between baby clothes, young adolescent clothes, even adult clothes, and some interview clothes. So that came out of it, as well as one of the panelists mentioned, during COVID, we teamed with health and hospitals, and we do COVID testing now, the nasal COVID testing during our pantry days. In Queens right now and in the Bronx, which is our two largest pantries, we do on-site COVID testing for anyone. And of course, it's free for anyone on the lines that wants to be tested.
I would just add too that next fiscal year, we are funding the NEON community stakeholder groups. And it's really just a brain trust of NEON leaders in the different communities who come to DOP and say, here are the needs that we are facing in our community. And we now have funding to fund some of those ideas. And so other ideas have came from the stakeholder groups previously, including neon arts, neon photography. And, you know, so it's a brain trust, right, from the people that say, this is what would be helpful to us. And we're able to fund some of that work. So again, that also empowers people as well.
Great, thank you. There's a question from an individual in Virginia, and they said, we provide mental health and rehabilitation services to adults. How can our agency work with the department to better assist the parolees and those released on probation with clinical mental health disorders and issues?
The first thing is have a conversation, connect with each other, and figure out together how you are going to serve this mutual client together. That's first and foremost. You're already serving the same client. You just have to decide how you're going to do it together that is going to be in the best interest of that client. So the first thing, like if someone came to me and I was coming to this community, new, first thing I would do is have a meeting together and figure out who are your mutual clients, how can you serve them together, and what is the best interest of the client. Additionally, you should be chatting with your stakeholders, the clients themselves. What would be beneficial to them? How could we be better connected to make sure they're getting the services and support they need to be successful?
This question's for Elder Linda, could you talk a little bit more about how you've engaged folks with COVID-19 vaccination efforts? What barriers have you faced in doing so?
So here in Oregon, folks who were incarcerated became part of the 1A group who were eligible to receive the vaccine. And we literally had maybe 1 or 2 days of prep before we did mass vaccination at one of our jails. What it did require was myself and another colleague going into each of the dorms or modules or pods, however your jail is configured, and doing a brief presentation. I did have some things that were aired regularly on the monitor. I had print materials, but what was most effective was actually myself and my colleague going in. We represent the community. We're people of color coming in, talking about why it was important for us to be vaccinated, our personal stories about our vaccination stories, and then talk about the impact that would have not only in the jail community, but once folks were released, and talking about the impact on their community and the families that they were going to go home to and how to protect those folks. That was essentially the approach. Was very personal. I wasn't afraid of any question that came my way. I was open to it. And I promised them experts. So we brought in state epidemiologists to come with us to each of those dorms. That was key. So folks could answer one was like just not knowing all the answers myself and saying, hey, I want to know this too. Let's bring someone from the state, or let's bring someone from our local public health authority that could really speak to these and address these questions. That's kind of my strategy.
Thank you. Lee, regarding your presentation, someone wants to know, can the client see their case plan and how do they access it?
So usually if they want to see their case plan, they work with their supervising officer, and their supervising officer will share with them their case plan. That's how they can access it. It's usually through their supervising officer. Of course, if they're in one of our transitional housing sites, their case manager also will be able to share their case plan with them. And when they meet with them, they're welcome to access it.
Thank you. What was the source of funding for the tiramisu and county operating budget? Was it a grant, or what type of funding?
I'm happy to report that our director's office made it a priority and included it in our county operating budget. Actually said that I agree this is something that needs to happen. So it was a priority. It was part of our county funding, and we were able to put it in motion. So we're very fortunate, and we were very fortunate that they prioritized it.
Is there a policy directive that ensures that people being released have the appropriate medical resources needed to secure health care?
Leave, I don't know if there was a specific policy that we wrote, but we made it a mandate for everyone that was releasing that was part of their care plan. We were pretty aggressive in making sure that everyone had access to medical care, prescriptions, durable equipment. We got caught on many a Friday at 5 o'clock with someone releasing who had a wheelchair when they were in prison and were released without that. So really it was I kept telling Lee, we got to go early. We got to go quick. We need to know every little bit that we don't know about this person who's releasing, and making sure that we give them every opportunity to succeed. If they can't move around because they don't have a wheelchair, you've got a problem.
I would just add that, again, we're fortunate that our leadership actually supports us prioritizing making sure people's health needs are met. We are very fortunate that we are able as a team to prioritize behavioral chronic health issues, making sure they have the things in place necessary for follow-up appointments, that staff are in place to make sure that they're able to make those appointments. And it really is that. It really is our leadership supporting and making sure, not necessarily through policy, but through their support, we understand that it is our priority.
And I think that, one of the things I've learned working with Leave and the wonderful folks over at Correction Health, it's also about really figuring out what this means in terms of numbers. So if you want to do research, figuring out what the cost of your emergency room is for this population, what is the cost of jail costs for these individuals who what folks are called frequent flyers or frequent users of these systems, and really start looking at the cost effectiveness of intervention and early and prevention and other models that work.
Thank you. I actually have a question I'd like to ask. What advice do the panelists have for probation and parole agencies that are interested in replicating these kinds of models in their jurisdictions?
Well, if anyone wants to run a pantry or I'm more than happy to share any experiences with them. Are you going to post our email addresses, Clarice, for this as well? They can contact me through an email address, and I'd be more than happy to walk them through what we've done.
Sure, I can do that.
I echo, people can reach out, but this is the one thing I would advise everyone. Never give up. Just be tenacious. As there are people who are probably listening right now who, if they know me, they know that I'm a pain because I just never give up. You just have to have tenacity. Just never give up. Always see the vision, and remember the folks you're working with are your neighbors, and we always want the best for our neighbors. Always.
There are best practices now that help support the work that we're doing, public health best practices, as well as supervision best practices. And again, finding that sweet spot where the two intersect is key. And I'm happy to talk about how that's worked for me and my experience working with DCJ and Corrections Health here in Multnomah County.
I wonder if I could jump in with a question as well. Jordan, you talked about that brain trust of folks and getting ideas from the community. I wonder if you could expand on that, but then if others have things to jump in. This is a theme that came up in some of Exit's previous webinars as well. Like, how do we ensure legitimacy, that ideas are coming from the community, from people within the community who are seen as leaders, as safe, especially with histories of systemic racism and with being, having communities taken advantage of by the system. How do we make sure that we're building trust and programs that people feel safe reaching out to? So I wonder if you could talk a little bit about that process of making sure that folks are connecting with legitimate voices in the community, that there is space to bring forward ideas, just sort of building off of that general theme.
Yeah. So I would say the neons do a great job of this, right? When you walk in there, you can get your high school equivalency, you can get help getting a job, you can get food, right? So when you go into a place and there are resources available to you, that builds trust with the actual people who operate the building. So that's one way to do it. Have resources there, to employ people from the community to deliver those resources, right? That's another way to build trust. So when you walk into the neons, you see people from the community doing the work as well as receiving the work, right? And so that's another way to build trust. I would also say, having funding to actually build out the ideas of the community leaders is another way. I mean, if you convene a group that's just for publicity, so you can take pictures or whatever, that's not going to do it. But if you actually have funding or have strategy to help enact some of the ideas that they have, that builds camaraderie. I would say the mayor's action plan for neighborhood safety also does a great job of this in thinking through the importance of elevating community leaders and their ideas and trying to meet the needs of people in NYCHA in the New York City Housing Authority developments. So I would encourage folks to look at the mayor's action plan for neighborhood safety in New York City as well as a model that truly builds with the community and invests in the ideas that come out of the community.
if I can add to Jordan's idea about the stakeholders, during COVID, just for an example, in Harlem, our building was closed. It was a multi-purpose center, and it was closed where we house our officers and our neon, and actually opened its doors so we can run the pantry. So we run the pantry out of one of the churches now 2 days a week, and we've done this through the pandemic. And through that, so the relationships are there to be built. People want relationships. They want to help one another. So that's part of stakeholder group of sharing the ideas. Hey, we got to close the pantry. Oh, no, you don't. Come to where we are. And, you can do it here, and we'll have church participants help, and you can deliver the food here. And it has just been a wonderful experience doing that within the community. Again, not even in our own spot where others are, but on the fly. Within a week, we were serving food in the community, thanks to a stakeholder, one of the Maurice Whitley, a pastor at the church, opened the doors to us just because of what we were doing for the community. So it's a win-win.
Would any of the Oregon folks like to jump in?
Just that I agree. We just have to make sure that we're speaking with our stakeholders and to keep that communication open and that we're working together.
I love engaging the POs, and it's really, for me, it's really humbling once I start hearing POs and corrections officers and deputies actually talking about social determinants of health. I hope that it even as I was listening to Jordan talk, I'm like, yep, that's a social determinant. Yep, that's a social determinant. It becomes a clear blueprint on how we can start seeing the human for the folks that we're working with and serving. It's just, it's so basic, it's so key. And we know that it works. So find your allies, find your tribe, and go forth.
Thank you. So this is our last question. I think one thing COVID has reaffirmed is how interconnected systems are: criminal justice, housing, food, security, education. If there's one message you could deliver to stakeholders or policymakers working in these other systems from the perspective of your leadership in the justice system, what would it be?
We all want the same thing. We all want the same thing. We want people to be, everybody wants everyone to have healthy and positive outcomes, no matter who you are or no matter where you come from. And I think the interconnectedness of that is just to remember we all want the same thing. We want healthy and safe neighborhoods. We want people to be successful. We want people, when they find themselves with a chronic health issue, to get the support they need. We want to make sure they have the housing that will best suit their needs so they can be successful. Because we want the same thing and we're serving our neighbors, if people can remember to stop siloing us. Our folks are not siloed. Our folks need housing, they need support, they need services. How they ask for that should not matter. What should matter is how we will respond to make sure that continuum of care is consistent no matter what door they go through. Please make sure that no matter what door anybody goes through, that we are wrapping around the services and support they need to be successful, and that should be our goal, no matter which door. I think what happens sometimes, especially in community justice, people see when they see it's us, they automatically have some other thoughts and concerns. And my thing is, no, their concern is they need a primary health appointment. They need supportive housing. They need an opportunity to work with voc rehab, which is no different than any other neighbor that you're working with. The difference is there are some choices that have been made, and that we need to look at that and look beyond that and look in helping this person be successful. That's what I would say. Think neighbor first, and it'll work for all of us.
Yeah, I just want to say that first, that question came from Dylan, who is a tremendous advocate on the closure of Rikers. And to Liv's point earlier on the never give up, I mean, Rikers will close. And if you hear from New York City mayoral candidates right now, they're all starting at the point that Rikers has to close, which was not the case some years ago. That wasn't the general consensus. So, just to tie back to the never give up point. Yeah, and to the question, I think that's why the Young Men's Initiative was created, because we know there are issues that cross agencies. And so if you empower an agency to have a budget in housing and workforce development and different sectors that impact people, then you can help solve those problems from a cross agency standpoint. And so I think having a mayoral office with funding that can see across different agencies to think through how to solve these problems from the point of view of the constituent and not the bureaucracy is one really strong strategy.
Thank you, everyone. I'll turn it back over to Kendra.
Great. So I want to just pick up on a couple themes that I heard, and thank all of our panelists again for joining today, and all of our attendees. I heard each of you talk about in investment and empowerment and agency in different ways, especially hearing the importance of making sure that people are supported in their basic needs, that they have the ability to self-identify what those needs are, and that, when we start from making sure that folks have their basic needs met, then we can think about next steps and making sure that folks are building the lives that they want for themselves. Something that I think is pretty universally wonderful, but especially important thinking of a criminal justice system that has often landed in communities in unequal and harmful ways. So I really want to lift up the examples that you all have shared of partnerships, really important partnerships between justice agencies and community leadership. And I hear each of you talking about ways that you're continuing to see and invest in that community leadership, which is also a theme that I've heard from a few of our different webinar conversations through Exit this year. So thank you again for sharing all of those examples, wisdom, expertise. Thanks to all who joined the conversation today as an attendee. And everyone can learn more about Exit at our website, which is exitprobationparole.org. A bunch of interesting links were shared in the chat, but if you have particular questions for any of our panelists, I know each of them have very generously shared their emails in the chat as well. But you can also reach out to Clarice or myself if we can help connect anyone. And we ask that you please fill out the survey that you'll receive shortly after we conclude. We're very interested in your feedback and understanding what was helpful, less helpful, and getting your ideas for future topics that we might cover in a webinar series. And I hope that you might join us for future events. So once again, thank you to everyone who joined. A special thank you to our panelists, Stephen, Ed, Leave, Jordan, and to Clarice for making this happen and for moderating our Q&A. Thanks all, and have a wonderful afternoon and evening. Take care.
Thank you.
Hey, thanks all.
Thank you all.